Okay, so Nitu, congratulations on your book that you've just published, Living PCOS Free.
Thank you, Akash. Thank you for inviting me, and thank you for mentioning my book right away. Yes, it's very exciting. It's a book that is not just for anybody with polycystic ovary syndrome, which happens to be the commonest cause for infertility, commonest cause for many. Is the most common hormonal condition or endocrine disorder. But it's actually a book that we've written to teach people about regaining hormonal health. Ooh. My dogs are barking. Is that going to be okay, or should
That's
we?
okay. I mean, if they're going to bark every minute, then that might be a problem.
I don't know if somebody's come to the door, but that's fine. Not to
That's
worry.
okay.
So essentially, the book is for regaining hormonal health, but I have had so many men reach out to me because it's a book that sort of teaches people about the body, about periods, about how to sleep better and stress less and things as well. So it's a deep dive in this endocrine condition, but it also is a book that will help, I think, and is helping many, I'm hoping.
Well, that's what caught my eye. I saw you published a book, and I thought to myself, not only do women who suffer with PCOS need to understand more about it, but I think men, as men, we need to know what it is about, what it is as well.
Yes.
And I'd love to know why did you decide to write a book on PCOS? You've had an extensive career where you've done pretty much everything there is in medicine. Why did you decide to write a book on PCOS?
That's a fantastic question, Akash. Actually, I've been wanting to write a book for many years, but because I was busy, I'm a surgeon, I was seeing about 4,000 patients a year. So I started in a pandemic. One of the offshoots of pandemic was I had a bit more time. And so I started writing a general reproductive health book, and my daughter, Rohini, who's a nutritionist, came up and said, but I just don't understand why you're writing 3 pages on endometriosis, another 5 pages on menopause. Really, we should be, you've got 35 years experience. Why don't you do a deep dive into one of the most stigmatized conditions and a condition that she has herself? And so initially, I wasn't really sure because it's a very complex topic. People don't talk about it. And then as soon as I thought a little bit about it, I said, yes, I'm in. And so we actually co-authored the book together. She's written all the some of the fourth part of the book, which is really interesting, has also got her recipes in. And we wanted to keep it all scientific. So that's the reason we wrote about polycystic ovary syndrome, because it occurs. So 1 in 10 women or those assigned female at birth have this most common endocrine disorder all over the world. Imagine it to be a cousin of type 2 diabetes. And so just extrapolating, once you look at all the studies, 1 in 4 women of certain subgroups. So when I use the word woman, I want to be inclusive. Anybody who's been assigned female at birth, who identifies as a woman or was born as a woman and identifies differently, I want to include everybody because it's important to know that. But what is interesting is there are several subgroups that the incidence may be even higher. Those who carry excess body weight, who live in larger bodies, those who have a family history of type 2 diabetes, those who are from the Asian community, those who are from the Hispanic or Black community, they actually can have an incidence of 1 in 4. So can you imagine a condition that is so common, but 75% of women will never, ever receive a diagnosis of polycystic ovary syndrome. They will never do that. And the reason is, Akash, what happens is there are multiple different ways that PCOS can present. So the most common is when you miss your periods or you have irregular periods. And so it's a diagnosis of exclusion. So basically it may be somebody has an eating disorder or is exercising too much, or maybe approaching the menopause, or may have early menopause. There may be so many reasons for it. So that is one of the most common signs. And they may go to see a gynecologist for it. But they may also have signs of what is known as androgen excess. Testosterone is the most common known hormone, but it's not a male hormone. For all the listeners out there, testosterone is produced, in fact, sometimes 4 times as much in reproductive age group women than estrogen, because the pathway is cholesterol breaks down through a very complex pathway into progesterone. Progesterone breaks down into testosterone and its various metabolites, and then into estrogen. So without testosterone, you can't have any estrogen. So when there are signs of androgen excess, which is the second most reliable sign, women can have cystic acne in their 20s. They may experience scalp hair loss. They may have excess hair where they don't want it, on the face, on the chest, on the inner sides of the thighs. And so what happens is there's a lot of stigma attached to, admitting that you're having difficulty in conceiving. PCOS is the most common cause of infertility because you don't release eggs. Also, you may be living in a larger body. 8 out of 10 people with PCOS live in larger bodies. And then you may have anxiety, depression, OCD, eating disorders. So you can imagine that if somebody has anxiety or depression, they won't even think that they have got PCOS, because they may go to see a psychiatrist. They may go to see a dietitian for, trying to lose weight. They may come to see somebody like me, a gynecologist, for irregular periods. They may go to see a fertility specialist for having a baby. They may go to see a beauty therapist for laser hair removal. They may go to see a dermatologist for cystic acne. And all of us as health professionals, nobody's sitting there joining the dots. So it is left to you as the patient to join the dots. And that is really hard. That is why I wanted the book to be, it was meant to be a 100-page book. It turned out to be a 470-page book. It's got lots of references. I didn't want anybody in the medical community to say, oh, this is not scientific. And I didn't want anybody in the wellness community to say, oh, the pill is bad for you or whatever. I needed all the science out there. How do you help yourself, whether it's with lifestyle, whether it is with medications? There should be no medication shaming, and there should be no over-promising of results for anything. So that is why I felt that if I don't empower the people that I care for so much, that is, the public and my patients, how are they going to advocate for themselves? So that is why the first part of our book is all about understanding your health, understanding how your body works. There was a survey in London in November 2020, and 1 in 4 women did not know where their vagina was. 1 in 2 women did not know where their cervix, which is the neck of the womb, and 1 in 10 did not even know where the entire reproductive system was housed. And so if you can imagine, if women didn't know that, men would have even less of a clue. Certainly, men don't even have an idea where most women's clitoris is, for example, So, and the other interesting thing with polycystic ovary syndrome is it's not a disease of the ovaries. It is a hormonal condition. It's an endocrine disorder. There's a mismatch of the messages sent by your brain. And there was a huge study, 172 or 175,000 men in the Oxford study, which looked, and they found that men also have characteristics of PCOS.
Oh, wow.
So what they have is they may have male frontal balding. They may have excess waist circumference. They may have a history of type 2 diabetes. They may have raised triglycerides, which are part of the cholesterol pathway. So they may have all these. They may have a sister or a mother with polycystic ovary syndrome. So we now know that it's not a disease of the ovaries. There's nothing wrong with the egg baskets that you're born with, the eggs. What is the problem is that the message is being sent from the brain to activate those ovaries. That gets disordered. And so that's why you have this condition manifesting in insulin resistance, which is the main driver. So your body doesn't recognize that it's got to push this blood sugar into the cells for you to have this energy. You work out, you talk about fitness, but you need glucose. And how do you get that glucose? That insulin has to push it. But if there is fat blocking those cells, a very simplistic explanation, if there's fat blocking the keyhole of the door that is to the cell, then you can put the key, which is the insulin, and still try to open it, but it won't open until you make changes to your lifestyle, whether it is shedding a little bit of weight or whether it is actually changing the way you eat. Because insulin resistance, we know for type 2 diabetes, actually works. As soon as you start addressing insulin resistance, the type 2 diabetes improves hugely. And the same goes for polycystic ovary syndrome. The sad thing is that international guidelines talk about behavioral changes and lifestyle changes, but they don't tell people what to do. So they just say, have a healthy diet. And we know that's a road to nowhere.
Wow. Okay. So there's a lot to unpack there. The first thing I want to ask you, and just for the listeners, so they're super clear, if you could say in one sentence, what's the layman's definition of PCOS?
It's a hormonal endocrine disorder. It's a hormonal disorder that affects the function of the ovaries. It's not a disease of the ovaries. It affects the way the ovaries function. And you have 2 of them. You're born with 2 ovaries normally. and it affects the way those ovaries function because of the messages being sent by your brain, and they affect because of the insulin resistance. So it's a disease that is characterized by, just remember it as a cousin of type 2 diabetes. The most common endocrine disorder to affect women of reproductive age that affects the function of the ovaries. And the closest way to understand it is insulin resistance drives it. And that is why it's a cousin of type 2 diabetes.
You said it manifests in a multiple ways, and the problem is often connecting the dots. How do you connect the dots if you may have it? Because someone's going to their dermatologist thinking it's acne, or they're going to see you thinking it's this. How do you connect the dots as a patient, or someone who's not even aware that they're a patient?
So that's what we try and explain in the book, is to actually understand and spend some time understanding your body. So it's very rare that you will just have cystic acne. If you have polycystic ovary syndrome, you will probably also have some problems with your periods. You may have other symptoms, sleep disorders, insomnia, snoring, sleep apnea, daytime sleepiness. You may have anxiety, depression. These are all the softer signs. And so it's important to know, do you have the hallmarks? Do you have period issues, or do you have acne, excess hair growth on your face or on your chest? Or do you have scalp hair loss? If you have those, that would be enough of a trigger for you to go and find a doctor who actually understands the condition. If they don't, then present them the book or send them to a website like the NHS or the Royal College, or to my website, so they can read about it and say, doctor, I need to have, if you're above the age of 21 or 22, I need a scan to see whether I actually may have these little changes, which are not true cysts, but they're just immature follicles. So there are certain criteria to be diagnosed with PCOS. Either you have to have the period issues, which is because of not releasing an egg. The second is signs of androgen excess, which is acne, hair growth, or loss of hair, or lab tests that we check to check your testosterone levels, the protein that is released by the liver to hold on to the testosterone, which drops in PCOS. So there are certain blood tests that one would do. So, as soon as you have a suspicion that your periods are not either coming on time, or you're having these signs of androgen excess, or you're having any of those other signs, you may turn out not to have polycystic ovary syndrome. That's okay. But you're still having an issue, and that needs to be sorted. Whether you're living in a larger body, you may need, further tests as to why you are. You need to have tests for insulin resistance to see whether you're not actually already, and we know Asian community already in their 20s and 30s, and children are actually getting diagnosed with diabetes. So if you have any suspicion that you may have polycystic ovary syndrome because of this excess hair growth or acne, or not having your periods regularly, then, or any of those other softer signs, anxiety, depression, OCD, any of that, don't ignore it. It may be that you don't have PCOS, but it may be that whatever it is, you need help. So you have to advocate for yourself. Otherwise, you can't live the life that you have been born to live. It's very hard, when people don't, self-care and self-image and self-doubt and psychosexual dysfunction are big issues for women, especially in PCOS, because you are so stigmatized because you may not get pregnant, although most women do. You may live in a larger body. You have hair when others are, smooth like dolphins. So you are then thinking, actually, I don't want to go out. I don't want to socialize. And that loneliness and not going out causes stress. And when you're stressed, your cortisol levels rise. So insulin resistance gets worse. When your insulin resistance gets worse, you then tend to reach out for foods that do not bring health, ultra processed foods and animal foods, for example. And when you don't eat very well, you don't want to move your body. And when you don't want to move your body, then you reach for the cigarette and the alcohol. And so those are the 6 lifestyle pillars. All of them come crashing down because you have decided, because of the way society is judging you, that you are going to talk harshly to yourself. And my words always, if you remember nothing from this podcast, those who are listening, remember that feed yourself words of love and self-care, because talk to yourself as if you would talk to your best friend or somebody you really care for. And so if you would not say those words to the person who's listening to you, who you love, then don't say it to yourself. And then take charge of your body. Write down your symptoms. Think about what the symptoms are. Do some research from scientific sources rather than influencers and things like that. So important.
Well, that's amazing. We're very lucky to have you here as a scientific resource. So tell us, if you're listening and you've got PCOS, or you know a friend who has it, a family member, what do you do? What
So
are
the
the
first
first initial steps?
So the first thing is you want to understand whether you definitely have it, okay?
Yeah.
Because it often starts in teenage years, but we can't use ultrasound scan to diagnose polycystic ovaries because young teenagers will often have ovaries that look multicystic. So it's not to be used. An ultrasound scan may be used for ruling out other conditions, but you need to have both the signs of androgen excess, the hair growth, the acne, or the hair loss, one of those three, or lab tests that show that you have androgen excess, plus missing your period. So normal periods, Akash, last between 24 and 35 days. So anybody who's going 40 days, 45 days, 2 months, 3 months, I get so many young women in my clinic say, oh yeah, I have periods once in a couple of months. No, that's not normal. That may
Mm.
suggest that you have polycystic ovary syndrome. It may suggest that you have an underlying eating disorder. It may be that you're exercising too much. You may have hypothalamic amenorrhea. There are so many causes. You may have a tumor in your ovary. Don't ignore it. So for anybody listening, if you're having period issues that are coming too early, coming too late, you're bleeding in between, you're bleeding after intercourse, you've not kept up with your pap smears or cervical smears after the age of 25, if you're somebody who's noticing those androgen excess symptoms, you're struggling with your weight, you're putting on weight when you're eating very similar to all your friends, if you're finding that you are struggling with just, validating yourself with anxiety, depression, sleep issues, constantly being tired, feeling sleepy, and not wanting to exercise, those sort of things are triggers. So then once you suspect that you may have it because of the period issues and the acne issues and things, you start doing a bit of research from the NHS or the Royal College of Obs and Gynae, or go onto my website and empower yourself. Once you write down all your symptoms, once you write down if you've seen any other doctors or any medications that you may have taken, whether it's been the pill, whether it's some metformin, whatever you may have taken, write it all down, because you only get 10-15 minutes with your doctor.
Yeah.
When you go, one of the reasons why I talk so fast, probably because we always have less time with our patients, and we try and plant seeds and give them resources. So what you do then is you write down everything. And when you go to see the doctor, you're not spending time, wasting time thinking, when was my last period? Or what is my cycle length like? Or who did I see? Or where did I go? No, have that information. Your doctor immediately knows you are somebody who's researched, whether it's Dr. Google or NHS. You mean business. You're not going to take no for an answer. You're going to find stuff, and you need a doctor who's experienced, but also is willing to listen to you and may well reassure you that you don't have the condition. But
Yeah.
remember, 75% of women never get a diagnosis because they're dismissed. Endometriosis takes about 6.7 years to have a diagnosis. 6.7 years living with painful periods, where women have been normalized and told it's normal to have painful period. No, it's not. Anything that affects the quality of your life has to be looked into. They live with heavy periods, they live with painful sex, so they don't want to have intercourse even when they're feeling like wanting to be intimate. It's so painful. They have chronic fatigue. Endometriosis is a condition where the lining of the womb, similar to the lining of the womb, which sheds every month, gets stuck outside and causes cysts and all kinds of issues, scarring and things like that. But if any medical condition is going to take 6.7 years, any condition never gets a diagnosis. 3/4 of women don't get a diagnosis. But the US spent $8 billion in healthcare for managing complications of PCOS last year, which means gestational
Wow.
diabetes, that is, pregnancy related diabetes. And half the women with PCOS who are living in larger bodies will be diagnosed with type 2 diabetes by the age of 40. So it's a huge public health concern, but nobody talks about it because it's stigmatized. So the celebrities rarely come out and say that they've got PCOS because not something that people want to talk about, that they're not able to
Mm.
conceive, that they have to go remove their facial hair if that's what they want to do. Sometimes every single day for 3-4 hours. They have acne, so people really found wearing masks during the pandemic actually something to hide behind and felt much
Wow.
more confident. So you can see how, which is why for me, I just want people to understand there is help available. There are good health professionals available. Anybody who dismisses you without proper reassurance, you have to push through. You don't have to worry about all the hundreds that are not being seen. You have to look after yourself. And you don't have to go private for that. You can go on the NHS if most of your listeners are British, UK listeners. You just have to keep, sometimes you have to do the hard work because people may not take you seriously because there were other things to, manage.
And what do you advise patients who have PCOS to do if they're paid? Like, what are some of the lifestyle practices that can help someone with PCOS? Because we hear it from the perspective of, I don't know if I can do this fitness journey because I've got PCOS, or I don't think I've tried so many things. I don't think I can lose weight because I've got PCOS. And we've seen a lot of our members with PCOS actually have incredible transformations with it, but there's a big myth and a big stigma around it. So can you talk around that, especially?
So there's a lot of myths because what happens is that there is no hard advice given by health professionals. But what we know very, very clearly is that you want to embrace all the 6 lifestyle pillars. Maybe choose one first and then move on to the next one. The 6 lifestyle pillars are managing sleep. Because when you manage sleep, that's when your cell gets repaired, cells get repaired, the DNA gets repaired. You tend to have your cortisol levels drop down. And so when you feel rested, you stress less. When you stress less, you tend to want to go out for a walk and walk in nature, or maybe with a friend. So community tends to become more important. So starting one of those 3, are you sleeping 7 to 9 hours? Are you getting restful sleep? Can you start with that? Can you then make sure that you're doing some mindfulness and breath work so that you're actually learning how to manage your stress? Can you go for a walk every day, or can you just do, lift a few weights by watching YouTube or joining your firm or whatever, So it's just understanding that you don't have to go to the gym. You may end up feeling very conscious because you're carrying excess weight. You may not want to do that. You may want to, but you may not. So you might skip in your room or dance to Bollywood music for about 5-10 minutes. That's all you need to do initially. So then once you've done that and you had a bit of a sweat or a gentle run or whatever you might do, you will then want to eat the right sort of foods that reduce inflammation and reduce your insulin resistance. And we know repeatedly, Akash, that there are some foods that will really help your journey and some foods that will hinder your journey. And the foods that really will help would be lots of vegetables, green leafy vegetables, lots of beans and legumes, and especially soy. You want to eat between 2 to 4 portions of soy in some form or the other. A handful of edamame beans, which is about 80 grams, about half a block of tofu some days. You want to eat some tempeh, which is fermented soy. You want to have miso. You want to have soy milk. You want to have soy yogurt. You want to have nuts, seeds, herbs, spices. You want to eat foods that satiate you. So potatoes with skin. You want to have sweet potatoes with skin. You want to have sweet potatoes with a chickpea curry. You want to have, tofu stir fry with some whole wheat spaghetti or edamame spaghetti. You want to eat foods that will dampen your blood sugars. And also, as soon as you've eaten, go for a 10-minute walk or jump up and down for 5-6 minutes. That will help to normalize your blood sugars and avoid the blood sugar spikes.
Can I just interrupt you? Can I just interrupt you for a second?
Of course you can.
I've never heard someone say be very specific with soy recommendations. Now I'm a fan of soy. I'm also vegan and I eat soy a couple times a day.
You don't have to be vegan to eat soy. Everybody should eat soy.
This is another thing. It's right. There's a lot of myths around soy. There's a lot of taboo around soy, especially in fitness. I used to think that, and that was one of my big blockers. But I've never heard someone say you should actively eat that much soy. Can you talk about why soy is not bad for you? Why it's not going to help? If you're a guy listening, you think you're going to grow man breasts, like all these sorts of things. What are some of the myths around soy, and how can you debunk them as a doctor?
I feel really passionate, although I'm not paid by any industry, but I have really researched everything into soy. There are over 20,000 studies, 2,000 papers every year for the last 30, 40 years. Soy is a bean, okay? Just like chickpea, just like kidney bean, it's a bean. It's a legume that has been around for thousands of years, first recognized in China. And so it's a soybean, okay? That's the most important thing to understand. So you don't give it, a hard time because it's a bean. And we know that the global burden of disease study said this, about 1 in 4 deaths can be avoided by people eating more fruits, vegetables, whole grains, and beans and legumes and things like that. And soybean is a legume. Now, it's a very good source of protein. And also the right type of protein. It has all the 9 essential amino acids, which is present in animal food, but also in all the plants, but it's arranged just like egg white. Egg white is a big thing in the fitness industry. Yeah. Now, soy has got amino acids arranged just like egg white, but without the nasties. So it's got the right amount of protein, the right type of protein. It has got a lot of fiber, it's got a lot of vitamins, it's got a lot of micronutrients. The reason it gets bad press is because it has something called plant estrogens or phytoestrogens. Now, those plant estrogens are present in berries, in flaxseed, they're present in chickpeas and kidney beans. But the reason why soy has come under so much of flack is because it has a tremendous beneficial effect, which people didn't recognize initially. It has a very weak action. So all plant estrogens, or phytoestrogens as they're called, or isoflavones and lignans as the subgroups. So soy is an isoflavone. What it does, it works only on the beta receptor of the cells, the estrogen cells, while mammalian estrogen, the sort of estrogen that you get from your body fat or from eating beef or chicken or dairy, is attacks both the or attaches itself to both the alpha and the beta receptor. Because soy attaches itself only to the beta receptor, what it does is it has something called a selective estrogen receptor modulator effect. It's a big mouthful, the SERM effect. So in short, what it means, it blocks the effect in tissues where they don't need the excess estrogen, and it promotes the effect of estrogen where it needs it. And it's a very weak action of estrogen, very weak, but it also blocks it. So for example, in the breast, when you're in puberty, it will help for breast growth. But if you're eating a lot of animal foods and things, it will dampen it down and reduce your risk of breast cancer. Same thing in men. It reduces prostate cancer by 25%. It reduces bowel cancer, ovarian cancer, womb cancer. So phytoestrogens, basically, if you eat soya regularly, beautiful study by Satyapalan from Hull, I think, where they showed that it actually reduces osteoporosis. And we know that in menopause, eating even a handful of mature soybeans reduces hot flushes by 84%. Lovely randomized trial. So soy has got protein, fiber, micronutrients, vitamins, but what it has are plant estrogens that are beneficial to you. They also help to lower your cholesterol, help you to have a slimmer waist. They help your heart disease. They help you if you have breast cancer. If you eat soy, you have something like a 30% reduction was shown in the breast cancer coming back and dying from it if you were already on, say, tamoxifen, for example. So those
Wow.
are big studies, big news, especially. The other thing people worry about is, so one, they worry about about breast cancer. And anybody listening, you can eat soy, and you should ideally eat between 2 to 4 portions of soy. Absolutely fine. And you would want the next question people will often have for me is that, it's destroying rainforest, and it's not. Only 6% of the soy that is produced for human consumption. Most of it comes from Asia. And the UK Roundtable of Sustainable Soy is very particular. In fact, most of the soy, I think it's 92% of soy is produced in all this Amazon basin and all that. And it is used for biofuel and for feeding the pigs and cows, because it's a very good source of fiber and protein. So it really makes them grow very fast, so, which is why they cut down all the rainforest and grow the GM modified soy. The ones that we eat, that's not a concern at all. It's not coming from those areas. And the more soy you eat, the less animals you will eat. So as a result, what happens is less rainforests will also get cut down. Most people eat about 10 kilos of soy when they eat animal products. That's how much soy they're eating through the animal. So it's so important. I have got a whole chapter on soy myth busting for men and women in my book, but also on my website about why men should not worry about reproductive health. It does not affect their testosterone. And we know that also by just looking at the Southeast Asian countries where they don't have a population issue. And so there is absolutely no concern. Weight loss, cholesterol lowering, heart disease reducing, breast cancer, liver cancer, bowel cancer, uterine cancer, and prostate cancer. Those it will reduce significantly. Okay. Polycystic ovary syndrome, particularly helpful in lowering androgen levels in women who have excess androgen levels. And remember, nature is very clever. Nature tends to decide for you. If you're having too much of something, it will come in there and help you reduce that. It's very forgiving. The body is very forgiving. And people often say, oh, but I have got thyroid issues, I can't take soy. Of course you can. All you have to remember is don't take your soy milk or your soy or tofu at the same time as your thyroid medication, because thyroxine and soy will both compete for the same receptor. So you just want to give a couple of hours, take your medication and then have it, or take your medication at night. Anyway, everybody should be eating by 7 o'clock in the evening. So you want to eat in the circadian rhythm, so your blood sugars get more normalized. You're also moving around rather than going straight to bed. So it's so important to understand these simple things. And the other thing, Akash, I always tell is whether always focus on health goals. Don't focus on weight loss goals. Because when you try to lose weight, almost every diet will fail. Every study has shown that people put their weight back on. Instead, focus on, I want to get fitter, I want to build muscle, I want to play with my children, I want to have children, I want to have less acne, I want to have no acne, I want to have less hair growth. Those are I want my periods back. That's the sort of goals that I encourage my patients, and Rohini encourages her patients, so that you will then see as a positive side effect the weight dropping off. Because as soon as you obsess about weight, that's again, a road to failure. So it's so important that you look at all the lifestyle pillars. No point just doing diet, because it's not a diet. This is a lifestyle. It has to be sustainable. What is good for you is also good for the planet and is also good for animals. So once you understand that, it's
Love it.
like, wow, why has nobody been shouting this from
Yeah.
rooftops?
Amazing. So you mentioned so handling PCOS comes to these 6 lifestyle pillars. I took you on a bit of a tangent with soy, but do you want to just confirm what
So the
those 6
6
are?
lifestyle pillars are sleep, managing
Yeah.
sleep, 6 to 9 hours of sleep. And this is not just for PCOS, okay? This is for type 2 diabetes, this is for heart disease, this is for cancers, anything
It's a way of
you
living.
want.
Yeah.
It's a way of living. So you want to always prioritize sleep. It's not cool not to sleep, like the way I thought, 35 years of very minimal sleep from night duties. So prioritizing sleep, good quality 7 to 9 hours of restorative sleep is so important. Okay, and if you're not getting that, you've got to see, am I having too much screen time? Am I
Yeah.
having caffeine and alcohol after? Well, you should, ideally you want to avoid that, but if you're going to avoid going to have alcohol, try to have it earlier in the day, because it will disturb your sleep. Same thing with caffeine. It's got a long half-life, so you want to be making sure that you prioritize sleep. You listen to a podcast or something smooth or soothing, or read a book, have a nice shower, drink some chamomile tea, finish your meal early, have a complex carbohydrate meal, which means like baked potatoes with some baked beans or some tofu and things like that, so that you feel full, but you still feel light. So prioritizing sleep, prioritizing stress management, mindfulness, breath work, going and walking in nature, Shinrin Yoku,
Yeah.
where you do forest bathing. So you want to be doing that. So stress management. The third is avoiding risky substances. So stay away from alcohol and smoking and drug use, and try to minimize your caffeine, especially if you have polycystic ovary syndrome and if you are finding you're getting quite anxious with it and things like that. That's your third pillar: sleep, stress, risky substances. The fourth pillar is exercise or moving your body. It doesn't have to be hardcore exercise in the gym. What you can do is watch little YouTube clips. You can dance, skip, gardening, cleaning your house, going for a walk with a friend. Those things also help a lot, especially outdoor. The nature really makes a difference. And so that's your fourth pillar. The fifth pillar then tends to be having a positive social network or community. So, feeling part of a community, doing charity work, feeling wanted, not having frenemies, having friends who actually make you feel good about yourself rather than dragging you down. That's so important. That find it, whether it's a book club, a walking club, a dance club, a fitness club. It doesn't matter what you choose. Find something that makes you part of the community. Go and teach people cooking, learn to cook, things like that. That is important. So community is the fifth pillar. And the last pillar is diet or nutrition, and trying to eat a predominantly plant-based diet, a whole food plant-based diet. By that, I mean really focusing on beans, especially all legumes, beans, dals, lentils, soya, green peas. These are all good sources of protein, but also very good sources of keeping you full and bringing your inflammation down. whole grains, intact whole grains. So red rice, things like amaranth and millet and ancient grains and quinoa, which is not really a grain but a seed. Nuts and seeds, having a handful of nuts and seeds. Try to avoid roasting foods because that increases inflammation, known as advanced glycation end products, which will damage your tissues and increase your polycystic ovary syndrome as well as heart disease risks. So really trying to focus on fruits, vegetables, avoid fruit juice, try to eat the whole fruit, try to eat the green leafy vegetables, really bulk up on foods that actually bring you joy and color. There's a reason why we have color vision, because we want to see this plate. So when you have a plate, fill it up with color rather than just beige foods. When you do that, you will find that staying away, it's not a question of what you can't eat. I never tell people what they can't eat. Of course, you can eat whatever you want to. Nobody's watching you, with a gun to your head. But what you want to think is, I'm choosing to eat these foods because they nourish me, because they are tasty foods, not I can't eat. So when somebody offers you a piece of chocolate cake, don't say I can't. Just say I don't want to. Or somebody offers you a glass of wine, just say today I'm choosing not to. So you don't feel that deprivation. You don't feel that you're depriving yourself. Instead, you are in control. You have to be in control of your PCOS. You have to be in control of your periods. You have to be in control of your type 2 diabetes, of your cancer, of your things. Because sometimes what happens is we can't help it. Genetics plays a huge role as well to an extent, but lifestyle plays a bigger role. So if you are handed a really not a very good card and you do end up with a diagnosis of any of these chronic illnesses, then yes, what you can't do is change away your genetics, but what you can do is make a difference to your sleep, your stress, the way you look at life, what you eat and what you put in your body, how you move your body, whether you choose alcohol and cigarettes and things like that, whether you want to keep friends who make you feel good. Those things are a little bit in control, not for everybody, because there's obviously socioeconomic factors, there's access, food, desserts. I understand all that. But I'm hoping that people who listen will say, actually, can I make a little difference? Can I go to the supermarket late at night and shop on things that are actually reduced in cost, but are not fries and things like that, but instead the fruit aisle and things like that. So simple things like that. I want people to understand that there is always hope, just because you have a diagnosis. And also, you may need medication. I would never want anybody to not have surgery, chemotherapy, radiotherapy, the pill, metformin, anything. You may need blood pressure medication. You may need all this. Despite living the most perfect lifestyle and doing all the 6 lifestyle pillars, you may still need it. And that's absolutely fine. There's nothing wrong with that. We are often made to feel very bad, as if we are letting ourselves down, and the society says, oh, but you're vegan. How can you be having a medical issue? No, there's a lovely book by Ginny Messina, Even Vegans Die, So we are reducing these things. We're not eliminating it. You can't eliminate everything, because we are born with a certain card that sometimes may raise its head, and life may come in the way, stress and all kinds of things.
So what I'm getting from everything you're saying is, if you're dealt with if you've got PCOS, you can still be in good shape. You can still work on improving your health. You can still work on improving your symptoms. And like the title of your book, you can live PCOS free.
Yeah, you can't reverse it. You can't reverse it simply because I don't like the word. You could reverse it if you continued living that lifestyle for the rest of your life. So there are studies to show that you can reverse it. But what I like to say is, getting control of your PCOS, putting it into remission. Because obviously, if you start stressing again, or if you start, sleeping badly or eating the foods that don't nourish you, of course, the PCOS will come back. I've had so many patients who didn't have periods for 2 years, and they changed the way they eat, the way they think, and boom, the periods are there. And now I have like 5 patients who are pregnant, recently. So these are all things that people have to understand, that it's not all or nothing. Both Western medicine and lifestyle medicine go hand in hand. But the most important message, as I said, has to be self-care. Feed yourself words of love so that you can then make a change, however small. Find yourself and you make the start. It's not what your neighbor does or what your friend does. It's what you want to do.
So do you think a lot of the misperception around PCOS come from the fact that many who suffer with it end up in that vicious cycle that you mentioned.
Yeah.
You talked about earlier, and one thing leads to another, and
Absolutely.
then you suddenly think it's just
Yeah,
not possible.
I can't do it. And
Yeah.
also remember that because doctors sadly don't understand the condition properly, what happens is you get dismissed. Come back when you want to get pregnant or go lose some weight. You
Wow.
know, remember 3 out of 10 people with PCOS actually don't carry excess weight. But even if
Yeah.
you're carrying excess weight, the answer is not just go lose some weight. Yes, it will help some of your symptoms, but how do you get on losing that weight? First, you got to change the way you think. And if there is nobody to help you do that and understand that there is hope, there are answers, which is why we spend so much time doing such a deep dive in the book. And that's why it makes me so happy to have partners reading it, men reading it and saying, wow, forget PCOS. I have learned so much all about the body and about, all the lifestyle pillars and what I should eat and all the lovely recipes. And oil is another thing that I do like to talk a little bit about, Akash, if I may,
Go
because
for it.
the problem is that oil in itself is not a problem, but it's a dense source of calories. It's about 120 calories per tablespoon. And so I prefer people to actually, maybe put a few drops of sesame oil or coconut oil or extra virgin olive oil on their dishes for the flavor, rather than trying to have large amounts of these oils, especially the highly refined ones, simply because when you heat oils to a high temperature, it releases those advanced glycation end products, causes a lot more inflammation. But also what happens is, remember, 74% of the population need to lose weight. They're either overweight or obese in the UK. And so instead of eating a tablespoon of olive oil, why not have a handful of tofu? You understand? So yes, extra virgin olive oil has got some health properties, but I would much rather that people ate good fats. So don't cut out fats. Eat fats, but eat them from nuts and seeds and soya, as well as from avocados and things like that, rather than eating, fats from which are liquid fats, simply because
Yeah.
you're going to feel not satiated, and at the end of half an hour, you'll be hungry again. So that's
Yeah.
why I try and explain it's fine. If you need to put on weight, you have no health issues, go for it. If you want to have extra virgin olive oil or cold press extra virgin olive oil or avocado oil and things are fine. But you really want to limit it when you have conditions like PCOS. And so all our recipes are oil free, actually, teaching people how to cook in water or applesauce and things like that. But you can also use oil if you want to, slowly cut it out, not suddenly go from, using 5 tablespoons to 0. I say you go to 4 and then 3 and then 2, and slowly over a few months, let your gut microbiome also get used to eating a different way. So take your time, don't rush. It's a
Amazing.
marathon, not a sprint.
Dr. Nitu, you mentioned quite a few times over the last 45 minutes or so around heavy periods and dealing with heavy periods. Now, you mentioned it in the context of PCOS as being a potential symptom, but sometimes it may not be linked to it. And I know a lot of people who do suffer with heavy periods, and it can sometimes take them out of action for a couple of days. They're in bed, they can't move, they can't work. What are some of what's going on here? I know this is obviously a massively broad
It's a massive
question,
topic,
but what's some of the
painful,
things that are going on? Yeah.
painful and heavy periods are not necessarily a sign of PCOS. Painful
Yeah.
periods could be because of many things. It could be the reasoning behind it is, as the lining of the womb sheds every month, it releases something called prostaglandins, and prostaglandins can cause pain, heavy periods, nausea, vomiting, diarrhea, constipation, all that. And so people may have painful periods just on the first day, for example, or just the lead up, and it settles down, doesn't affect their quality of life. And we have shown that plant-based diets actually can reduce that. Eating ginger regularly can also reduce your pain, and similarly to ibuprofen group of drugs. But painful periods could be a sign of endometriosis. You could have, pelvic inflammatory disease. There could be many, many other causes. Fibroids can cause heavy periods. Endometriosis can cause heavy periods. Previous infections with sexually transmitted infections called PID or pelvic inflammatory disease can cause heavy periods. There are many, many reasons for heavy periods. But what it is that your doctor doesn't decide whether you have heavy periods or not. You decide. So anybody whose periods last for more than 7 days, anybody who finds that they are leaking, having clots, having flooding, or passing clots that are bigger than the size of your thumbnail, anything that affects the quality of your life, is a heavy period as far as you're concerned, as far as the doctor is concerned. We don't measure the amount of blood. Actually, the amount of blood that is lost by women is not that much. It's mixed with vaginal debris and cells and all that. So it's only 80 milliliters, and more than that is considered a heavy period. So people say, oh my God, I lose much more than that. No, actually, that is what the average lose. But all you need to do is see your doctor and ask for a blood test, a simple blood test to check your iron levels and your iron stores. That will be the first starting point, because the most common cause of anemia, 1 in 5 women, will be because of heavy periods. That is how important. And the number of people I see getting blood transfusions, iron infusions, and nobody's treating the heavy periods. Nobody even asks them if they have heavy periods. So heavy periods, again, very important topic. And so I've written a lot on my website, because it is easily treatable. It is easily managed. And so you don't want to miss out on having the right tests, maybe an ultrasound scan, the blood test, and then taking medications that as appropriate, or surgery as needed. But also diet is really important. Eating iron-rich foods. And iron-rich foods does not mean animal foods, because those have a high amount of heme iron, which is not good for you. What you want to have is, you want to have iron-rich foods such as apricots or dates or cashew nuts, green leafy vegetables, soy comes up everywhere. So, you want to eat foods like that bump up your iron levels. And you may need to take iron medication as well, but you want to be doing that. A person who's on a proper whole food plant-based diet, who's eating very well, actually can have very good iron levels. I see that all the time in my clinic. You don't need to always supplement. But if you are having heavy periods, you may need to supplement, you may need medication, and you may need surgery. So you should never ignore it and not let, again, be dismissed. So important. Painful periods, heavy periods, not being able to conceive, painful sex, not having your periods, signs of androgen excess, that means acne and things, anything that is bothering you. Don't take no for an answer. I always say, I think I have a section says, nobody loves your body better than you. Not you, not your partner, not your parents after you're a baby. You have to be the one to advocate for yourself. And, I want any health professional listening, hopefully, to take that message as well. Don't dismiss your patients. Think about how you would want to be spoken to, how you would want to be addressed, and address people when they come to see you, because they are desperate and they want your help.
Wow, it's incredible. It's been an absolute pleasure hearing so much value packed into the hour. And I like what you said earlier. I've learned how to speak fast. I can pack loads in. I think this is one that people need to listen back to a couple of times to make sure
I'm sorry.
Value.
I always think I'm going to talk slowly, and then I'm so passionate 35 years down the line, Akash, and I love every minute of what I do.
I can tell. I mean, there's very few people I meet as passionate as you. So we could do this for hours, and I hope to do another episode with you, because I think this is very, very amazing. Where can people find out more about you, and where can people find out more about some of the resources you have on the very specific things you've talked about today?
So I spend a lot of time, and I have for the last 20 years on my website. I put a lot of effort in, because I want everybody who may not get to see me be able to access those resources. They're all free. They're downloadable. Doctors do that all the time. Nurses do it. Patients do it. The public do it. So it's nitubajekal.com. Just have to put my name in. So you can share that in your notes.
Yeah, we'll put it in the notes.
And I'm also on social media. So I'm on Instagram and on TikTok, because I want to reach people, of all generations. I don't want to be somebody who is stuck in the old dark times, because I just want to empower men, women, all genders, everybody. I love what I do. Absolutely.
If you got one more message for the listeners, what would it be?
Love yourself. Really mean it.
Amazing. Thanks so much for coming
on. Don't let anybody run you down, because it can happen very easily, especially if you're a woman. Getting underconfident is a real issue. So love yourself. Self-care, self-love.